Hello everybody, ready for another episode of Ask Dr. Bob? Some very interesting questions. I really had to ponder some of these today. Someone said, Dr. Bob, I recently heard on my local news about the symptoms of heart attack and stroke. Are they the same or symptoms for blood clots? Is there an easy way to tell if you're having any of these attacks on your health? Well, we could probably talk this whole Ask Dr. Bob about this alone. Heart symptoms could be anything from vague digestive distress, which you've heard commonly, the left arm pain, but I don't always see people with left arm pain per se. Unfortunately, the first body signal for 250,000 people for heart attacks really is death. So you can say, then what happens? You can see, if it was really simple, heart attacks wouldn't be the #1 cause of death in America. So you want to make sure your blood pressure is okay. That is very important. That's going to help prevent stroke. It's going to help prevent heart attack. You want to make sure that you have a diet that's not causing inflammation. I like to finally do the squeeze the wrist test. What I'd like you to do when you're done is look at your wrist and squeeze it. Like, I can feel bone right here. I don't feel a layer of fluid between my skin and my wrist. There's bone right there. There's no layer of fluid. There's a test that we do called the essential fatty acid blood spot test, EFA blood spot. You want to make sure your EPA is high. EPA is eicosapentaenoic acid. Your DHA is elevated, and your ALA is elevated. You can say, what are those fats? Well, DHA is docosahexaenoic acid for your brain, and the other one, alpha-linolenic acid, has to do with brain function and also has to do with inflammation in your body. You don't want inflammation. You do not want elevated omega-6 fats. You don't want elevated trans fats. Now, I know that people are bruisey really easy and they take all this aspirin and thinners. You know, you could have a stroke because you're taking aspirin. So I mean, there's a lot of conflicting information. So here's my tip. Make sure your blood pressure is within normal. If you smoke, it could be a greater issue. Make sure you're drinking water. Your blood pressure, like I said, is critically important. Do the squeeze the wrist test. If you're taking blood thinners, you don't necessarily want to take flax oil. If you have digestive distress, let me put it to you like this. If you do activity and you notice that you have an increase of symptomology, it could be your heart. If you're just resting and you're having distress, you know, you may want to have your carotid arteries checked. There are so many possibilities, and I know that I'm being vague right now because if there was a simple answer, nobody would have heart attacks or stroke. You know, I went to the Life Source and had my arteries checked, and I had my aorta checked with an ultrasound, and I had a clean bill of health. I don't smoke, and I'm not overweight. Really great question, though, and I hope that I helped make a difference for you. This is a very interesting question, too. Why is blood sugar reading higher in the morning than is prior to bed time? The night before, some people even, nothing was eaten after 8 p.m. and digestive enzymes and HCl were used. So I think this individual is having higher blood sugar in the morning compared to when went to bedtime. You know, your body does resting at nighttime. I know your thyroid's very important. I also know that people who have sluggish thyroid may have a morning headache because they're not processing their blood sugar. So a lot of times I'll find people with blood sugar stress in the morning because they actually have a low thyroid gland. So if you have a morning headache, have your thyroid gland checked. Do your blood glucose consistently. I mean, there are so many possibilities. Probably something that's more consistent is the HA1C because it tells you what's going on the last 3 months. So it's not the last 24 hours. It's the last 3 months of your blood sugar. HA1C would probably be more definitive for you. So the question was, blood sugar at bed is normal. I wake up in the morning, it's higher. Have an HA1C done instead of a fasting glucose. And what have you been eating the last 24 to 48 hours? Personally, I would not eat fruit at nighttime, only in the morning. Dr. Bob, I have psoriasis, arthritis, psoriatic arthropathy is what it's called, and take Motrin and using a steroid creams. I can tell you from my experience, one of the leading causes of psoriasis is compromised liver function. You want to do Dr. Bob's ABCs. You want to avoid medications if you can. Medications compromise liver function. especially statin drugs. Alcohol will always compromise liver function. half a red apple, third cup of beets, 4 or 5 baby carrots. I've also had people have improvement by making sure that they could do a castor oil pack. That's putting castor oil on flannel pudding right here on top of your liver. But the liver is the key. Beets, dandelion root are very important. Dr. Bob, I am taking a natural hormone replacement therapy, but I still have hot flashes. Any thoughts? We see hot flashes are caused by lack of iodine. And we're working on having a urine iodine test that you could just do a very simple stick. We're working on it. You could go to our website, druglessdoctor.com. It's all in a process now, trying to help you determine iodine levels. And of course, you could always do some saliva testing for your female hormone panel. Dear Dr. Bob, I'm 44 years old, and my hair starts to thin, and it seems to be coming out. Is there something non-prescription? I can tell you from my experience, the leading cause of loss of hair, low thyroid, stress, not enough protein in your diet, poor source of oils. You want good oils. You want to make sure your thyroid gland is functioning optimally. Did you recently just have any children? Because children can really stress your body and cause thinning hair, having babies. So if you're 35 and older, make sure you're doing enough oil, have protein. How is your thyroid doing? That is probably the #1. TSH, T3, T4, TPO. Those are the blood tests. TSH, T3, T4, and TPO. You want to make sure they're within normal. So hot flashes, because the same person asked the question before, hot flashes, iodine, thyroid. You see how it's all tying together? Great question. Dr. Bob, how can I avoid the super bugs that they've been talking about? Well, first, the super bugs are very common in hospitals and nursing homes. And the research that I've done recently completed, is people who have weak immune systems. So I personally take a product called Agricept every day, 10 drops. I don't eat sugar. It's really important, by the way. Vitamin D and iodine are also important for your immune systems. I take 3 drops of demulsion on my tongue every day, and I take 12 milligrams of iodine every day. That helps keep my whole body functioning optimally. I don't eat sugar. Sugar compromises immune system function. And I'm just trying to help you. A lot of people sometimes get upset. Well, Dr. Bob, I want to eat that. Well, I'm not saying you can't, but it compromises immune system function. Recent article, ADHD kids becoming ADHD adults. Dr. Bob, what do you think about that? You know, it's kind of interesting. I just got an editorial review in regard to that. We have talked about it for years. You know, I released my first book way back in 2000, and we know that ADHD kids become ADHD adults. I've known it for years, and it's because unless they change their diet, they keep on eating trans fat and having poor diet, they're putting the wrong fat in their brain. And I just get Dr. Bob's Guide to Stop ADHD in 18 days, or you can Google me. I have a 13-minute video on ADHD. It'll make a huge difference. Okay, next week, I'm going to bait all of you. I want you to come back and listen next week, because I'm going to give you 3 tips to improve your memory and to prevent Alzheimer's. Thanks for joining me. Pass this on.